Hey, everybody. So I'm going to give it a second for y'all to come on in here and come join me. And while you do that, I'm going to be sharing this onto my regular page for the folks who aren't following this page just yet. That way I make sure everyone has an opportunity to get in on this conversation. I will be very frank with you and tell you that I was not up for this broadcast today. Being back into the world of Ballad health and lots of research and then lots of information coming my way has been daunting and slightly overwhelming because there is just so much of it. And while I'm talking, I just reminded myself of something else I need to talk about. So give me 1 second. Make sure you speak when you get in here, but give me a second. I need to not forget this. So give me 1 sec, and this way I can get these things all taken care of. And I'm sharing so that everybody else can watch as well. And so that is good. I'm taking care of that. Say hi when you get in here, folks. And so that we can go ahead and get started. This is going to be, let me just say this. I take zero pleasure in tonight's broadcast, but it's really, really important that people see this. Hey, Melanie, and that we talk about it. Hey, Tammy. Hey, Ethan. How are you guys? You guys doing okay? So we're going to be talking about several different things tonight. Predominantly the theme, hey, Teresa, is going to be around ballad health and the NICU. And I've received some information in the last week or so, not only from parents in the NICU, but also from staff. And the things that I'm learning are just, I don't know what to say about it. So I'm not going to say much just a second. So that you guys can hold me accountable. Hey, Donna. So that you guys can hold me accountable. Here's what I want to make sure that I cover and that I do not forget. Okay. So right off the bat, we're going to talk about the closure of Holston Valley Medical Center's NICU, Neonatal Intensive Care Unit. And I'm going to be talking to you about some of the monetary discussion that Ballad Health provided to the Tennessee Department of Health to kind of justify closing the NICU. And I'm going to show you some of that information. So I want to talk about that. And then I want to talk about executive bonuses. I also want to talk about the recent bonuses that they announced yesterday after my broadcast on Tuesday. I want to share with you some disturbing images that have come from a mom and dad who had twins in the NICU who just came home recently. I mean, really within the last week, they were able to come home. So we're going to talk about that. I'm going to share that mother's story that she put up as a post. And let me just say this. She could not join me tonight. The babies did go home, but she will be joining me for our conversation and a more in-depth interview. So I'm going to share with you her post tonight. I'm going to share with you some pictures and videos that she shared. And then she's going to be joining me in the next couple of days. I know what it's like to have a NICU baby come home. She's got 2 of them. And so I told her to let me know when she could join me. So we're going to talk about all of those things. Did I say hi to everybody? Hey, everybody. All right. So let's just dive right in. So the first thing that I want to talk about is, let me just preface this. Most of you guys who know me, you know that your grand is due in May, Melissa. Most of you all who know me, you know that my interest in Ballad health was a personal one to start with, right? That's how I got involved. Like, I didn't just pick a healthcare system and go, ooh, let's go sleep outside of a hospital for 257 days. That is not what happened. Better high on that platform. Okay. All right. So you all know that my granddaughter Bella was born at Holston Valley Medical Center in August of 2017 at 26 weeks, weighing 1 pound, 3 ounces. With all her little cords and stuff, she was about 1 pound, 4.5 ounces with everything on her, right? And you all know that she spent 91 days in that NICU. And You all know that I was contacted when staff began to hear that Ballad Health, after the COPA was granted, planned to close the Holston Valley NICU. And then that it didn't take long for me to do research and find out that the senator that proposed the legislation to create the monopoly is employed by Ballad Health as a vendor. It didn't take long for me to figure out, that Alan Levine had come from several other healthcare systems that had all been found guilty of fraud that took place during his tenure. Not saying that he had anything to do with it, just saying that is the case, right? The places where he's worked before. And it became something that I was very passionate about, because what I felt like, and what I still feel like, is that the community in the region were taken advantage of by politicians, by business leaders, people who call themselves the hole in the wall gang and brag about controlling 65% of the employment in the region. It is my belief that they gave you guys a false narrative about what was going to happen to your healthcare systems, and they sold you a medical monopoly, and now you have no choice. And you don't have options with regard to your care, and that matters, especially when we talk about babies. And I want to talk to you about babies. So the first thing that I want to do is I want to remind you that Ballad Health had announced that they were closing the NICU, but they had not gotten approval from the Tennessee Department of Health back in 2018. And it wasn't until I submitted this information to the Tennessee Department of Health, and I had you guys all submit information to the Tennessee Department of Health, and we raised holy hell in such a good way. We made good trouble, y'all. We made good trouble. And it wasn't until we did that the Tennessee Department of Health said, "Hey, Ballad, you didn't tell us you plan to close the NICU." And what was interesting about that was that Ballad Health had included it in their documents for their bond ratings to the SEC. And that was in May of 2018. So Ballad knew in May of 2018 that they intended to close the Holston Valley Medical Center NICU, but they did not inform the Tennessee Department of Health directly and get permission, which they were required to do. So what happened is, as we began to hear this, and the volume at Holston Valley began to go down as they were kind of planning this transition, the Tennessee Department of Health said, "Hold on, pump your brakes. We have questions and we need some additional information." And if you remember, Commissioner Lisa Piercy had requested some specific information from Ballad Health and Alan Levine, and they passed some letters back and forth. And I want to share one piece of one letter with you, because it dawned on me today when I was kind of looking at these numbers again, the broadcast that I did on Tuesday. Do any of you all remember? Well, let's get to that in just a second. So let me just show you this. So this is a response that Alan Levine sent to Commissioner Lisa Piercy, okay? And the question from the Tennessee Department of Health was, the financial analysis for the project, including the monetary investment to be made for telemedicine and patient transport and whatever, and then how the investment relates to the financial commitments under the terms of certification. Then it says, hey, so this is what they said. They said that Holston Valley Medical Center was operating at a $1.5 million net operating loss, which, let me just tell you this. Anyone who knows anything about hospitals and healthcare systems, you lose money when it comes to your children's services. They're just super duper expensive. This is not something that is new. And there are other areas of the healthcare system where you make them up. Okay. So most NICUs are going to be operating at a loss. Okay. But this is what Ballad Health said. They said, hey, listen, because the Tennessee Department of Health said, well, how much would be offset by reducing the NICU to a level 1? And let me just be clear about this. Let me be clear. There's a level 1 NICU is just a nursery. There is no NICU at Holston Valley Medical Center. Matter of fact, they give birth over at Indian Path now. Okay. But so this is what they said. Per the response sent to the state on December 28th, 2018, the estimated cost for the monetary investments and additional service in Kingsport for rabies will be $456,840. This would result in a cost savings of $1,043,160. So $1,043,160 is what Ballad said. Hey, listen, This is how much money we're going to save by shutting down this NICU. Well, I would offer to you that maybe they didn't save $1 million. Maybe what Ballad Health did, because I want you to remember that they closed the Holston Valley Medical Center NICU on September 1st, 2019. I want you to remember that date, okay? Because I want to show you their tax return for 2019. And hold on, let me scroll back up to the top really, really quickly, because up at the top, what you'll see this period is for July 2019 ending in June 2020. So this tax return is for the year after the NICU was closed. And the NICU closed September 1st, 2019. This tax return is from July 2019 through the end of June 2020, okay? Now, I want you to remember, Ballad Health said, oh, we're going to save $1 million. Well, did they really save $1 million? Or did they simply defer that money for their employees in a bonus? So let me show you. When you scroll on down here in this tax return, what you're going to see are some bonuses for their executives. Yes, Chelsea, I'm going to be talking about Chelsea Cox and her twins in just a minute. Whoops, let me back up. So right here is where I want to get to. So do you all remember how much I told you this totaled up to, these bonuses? And I'm not talking about the salaries, but I'm talking about the bonuses. Do you all remember how much we talked about the bonuses on that were given to the executives for the year of 2019? Do y'all remember the number? Does anybody remember that number? It was $3 million. So I want you to look at this second column right here that says bonus and incentive compensation. And you'll see that Alan Levine's bonus was $800,000. You will see that Tony Keck's bonus was $228,000. Folks, just between the two of them, that's $1 million. Just the two of them. So remember when they said they were going to save $1 million closing Holston Valley's NICU? Did Ballad Health really save $1 million? Or did they simply defer that money and give it to their executives? And how do you feel about this nonprofit healthcare system saying it had to close a NICU that cared for babies and then turn around and give almost $3 million or maybe a little bit more than $3 million in bonuses to their executives? Because I'm showing you the bonuses. Now, I want to talk about this. Do y'all remember? So right after I talked about these bonuses that were given out, but in the year of 2019 to June of 2020, okay? When I talked about this on Tuesday night, the very next day, Ballad Health announced on Wednesday, yesterday, that they were giving employees this bonus of $1,250 per employee. Did y'all saw that? And they're going to give them $500 or $750 in one shot and $500 in another shot, right? So I want y'all to pay attention to something, okay? Tony Keck's base salary in 2019 was $436,000. His bonus was nearly half that. Do y'all see that? Even Bart Hove got a bonus, and he doesn't even work there. Clay Runnels' base salary is $432,000. His bonus was $122,000. Eric Deaton, $500,000. His bonus was almost $250,000. Their bonuses are ranging right around that 45% mark. Can you imagine getting a bonus that's 45% of your pay? They did. And now I want to compare that to this bonus they gave their staff. Okay. So if you take $1,250, okay, and you divide it by 40 hours a week, and there's 2,080 hours in a year, right? So 40 hours in a week times 52 weeks a year is 2,080 hours a year for a full-time employee, okay? So if you take this 2,080 hours and you divide it by that $1,250, that means these employees were given basically 60 cents on the dollar, 60 cents an hour for their raise. That's what they got. 60 cents per hour is what they got. Now listen to this. I need to tell y'all stick with me and listen to the math. The average inflation rate for the last year or so has been 6.5% to 7%. So if you're a Ballad Health employee and you make just $10 an hour, then this little bonus they gave you will keep you right at inflation. It'll cover the cost of inflation for the last year while you've been busting your ass during a global pandemic. But if you're a nurse, if you're a respiratory therapist, if you're an occupational therapist and you make more than $10 an hour, you're not even keeping up with inflation. But they can afford to give their employees 40% raises. They're executives, I mean, not employees, for goodness sake, but they're executives. But what I really want you to take home from this is that right here, if you look at the beginning of this tax return, right here, the period, it says right underneath this 990, it says for the 2019 calendar year or tax year beginning July 1st, 2019 and ending June 30th, 2020. Holston Valley Medical Center's NICU closed on September 1st. So this $1,043,000, $43,160, Ballad Health didn't save that. It was deferred and given to bonuses to their execs. Y'all might say these people work hard. I don't think these executives work any harder than the nurses and the doctors and the respiratory techs and the regular techs and the therapists and all of the folks that have been on the front lines of this global pandemic. I don't know that they've worked. In my opinion, they haven't worked harder than them. And I think it matters, the transparency, when you're looking at the public, because you all don't have any other choice when it comes to your care. And so now let's talk about what that looks like. Okay. I want to talk to you. I was tagged several times today. I was tagged several times today for a post that was put up by a mom, Chelsea Cox, in the NICU. You guys may have seen it. And I'm going to read it to you. And then I want to share with you. Matter of fact, how about I do this? Well, no, let me read it to you first. Let me read it to you first before I share this video with you, okay? Because you will be flabbergasted. So they have two babies that were born at 29 weeks. These twins were. One of them weighed 1 pound, 15 ounces, and the other one weighed 2 pounds, 8 ounces. Okay, they're home now. But listen. This is Chelsea's post that was put up 6 days ago, and it says, avoid a JCMC/Nicewonger. I have waited and wasn't planning on posting this, but now I am absolutely fed up. And then she says, backstory. We were having communication issues with the staff in the NICU. So we came in one Tuesday evening, and I noticed Oriah. I hope I'm saying your baby's name right. They noticed Oriah's eyes were really cruddy and stuck shut. And I brought it up to the nurses, and they said that they hadn't noticed it, and it had to have, quote unquote, just happened because they weren't aware of it, although it was dry and stuck shut. So it had to have been that way for a while. And here's what's crazy. So Chelsea, we haven't had a chance to really talk yet, but what I will tell you is that your baby is one of 3 babies I heard about with this condition. But here we go. And I'm reading her post again. After we had left, they apparently tested her for MRSA and didn't tell us anything about it. We came in Wednesday and Thursday where they allowed us to hold her. Because remember, MRSA is not airborne. It's a contact spread. After we had left, they apparently tested her for MRSA and didn't tell us anything about it. We came in Wednesday and Thursday where they allowed us to hold her and her twin sister without telling us that there was a MRSA test pending. This is the mother's words that I'm reading to you. Knowing that we could have transmitted it to ourselves, our other twin, or our 3-year-old at home. Come Friday, we find Oria's bed taped off with nurses in blue gowns and hairnets. And we asked what it was about. And they responded with, quote, "Didn't anyone tell you your daughter has MRSA in both of her eyes?" So we asked for someone higher up to speak with for an explanation on why we weren't notified, because we were assured that they would keep us up to date with everything. They end up sending the lead night nurse, and she told us they didn't have to tell us anything. So we asked for her superior, and she declined to give us her information and said, quote, "My boss is home in bed," end quote, and left the room. So I told my sister about what had happened, and she calls up and asks why they are treating us this way and asks for the higher ups info, because the sister apparently works in pediatrics and knows all of the terms as well as our rights to ask for info. And she gets laughed at and hung up. So what Chelsea is saying is that her sister works in pediatrics and knows the healthcare lingo. And so because she knows the healthcare lingo, she's called over to the NICU and said, "Hey, why are y'all treating them this way? Who we need to speak to somebody that's above." And apparently she gets laughed at and hung up on. So then Chelsea goes on to say, "Next thing we know, the desk nurse storms around the corner yelling, quote, 'You don't need to be contacting your sister telling her anything. You can't do that,' end quote," and saying she, quote, "won't be talked to like that," end quote. Even though she wasn't talked to any type of way, she was just asked questions on why the staff, on why the staff, I got to hit the little thing so I can see the full picture, hung up on my sister. So it says, so she goes on to say, the video has the rest. This woman jabbed me with the end of her pencil, which bruised her. So apparently the desk nurse poked the mom with a pencil because she didn't want to be talked to a certain way by the person on the phone, and got in my space. And so Chelsea says, this woman, as well as many other nurses prior to this, always had a bad attitude when answering the door and make smart remarks like, "What do you need? Why are you here?" Using dirty isolettes, dirty sheets on our babies' beds with puke and spit up and blood on them, using old equipment with expiration dates on them, but not discarding them when they need be, not wearing gloves, leaving our babies spitting up on themselves. I'm reading directly from the mom. I don't know how many times we had walked in and one of the girls had been choking on their spit up with all the vitals going up and down with not a single nurse in sight. The list goes on and on. Have talked to their nurse manager and HR, but they excuse the actions of the nurses, for the most part, summing it up to quote unquote protocol. Fast forward, she claims she wasn't allowed to tell us what happened to the violent woman and couldn't guarantee our babies wouldn't be around her again. She wasn't sympathetic. She made a sarcastic apology and since then has been downright fake, along with most of the nursing staff. Going to their superiors in HR actually made things worse. This place has been a nightmare and no one affiliated with the hospital seems to care. They just have been rude and dismissive. And now after us arguing that one of our twins was not ready to go home, they send her home anyways. Her temp has not been over 97 since we've been home. She isn't eating at all because a day before she was sent home, she was still being tube fed. So she was nowhere near ready to be stuck on a bottle full time. And she has lost 6 ounces in 2 days. Jesus. Sorry. I hadn't read all of this part. Now that we are here, they won't stick her back into the NICU because, quote, they try to avoid bringing the outside world in, end quote. So she's in the children's emergency part where a child in a room down the hall has COVID. She's back in an isolette, nothing to help bring up her body temperature, nothing to help bring her oxygen back up, nothing to help put her weight back up, nothing to help get her fluids or eat anything. She had the audacity to pin this on me, trying to say I haven't been feeding her right. And then the mom goes on to say, please, for the love of God, avoid coming to this hospital or bringing your children here if at all possible. Now, I'm going to share with you the images and videos that Chelsea posted with this post today, starting with this video right here. This is the baby. And what they're showing here is, see the sheets. Can you guys see the baby sheets? Can you see this, what appears to be spit up and stuff? I mean, like, it looks like it's even on top of the cord. Can you all see this? These are pictures and videos that the parents took. So this was given to them and told them that it was new. Going to keep going. So if you can see, the start date says 12/23, discard date is 12/24. I need to pull this picture up on my phone because when I put it in here, you can't see it, but you can hear. So on the picture, can you see, oops, let me take this down for just a second. So can you see where it says picture taken on 11/28, still being used 4 days after discard date? I think she means 12/28. So this is something that I had been told is a practice at Niswonger, that you see this blue painter's tape. I have been told that it is not uncommon for a baby that needs to be in isolation. And let me just tell you this, I have been told this by current staff, former staff, and now you see pictures from a parent, that when a baby is supposed to be in isolation, that baby may be in a room with several other babies and just have blue painter's tape around it, and that's supposed to be isolation. I'm going to keep going. This is the isolette. So you all know that at the beginning of every shift, right, the idea is to sanitize your workstation, the isolettes, the everything, right? But this is the isolette. This is when little mama was actually in the children's hospital, and because they put her back into the NICU. Let me just show you. That's a NICU baby in a peds bed. I wonder if this meets the standard of care. I wonder if, if we were to send this off to Vanderbilt or Knoxville Children's Hospital or East Tennessee Children's Hospital, I wonder what they would say. I'm going to keep going. So now what's coming up is going to be, I believe, the actual video. So what you're going to see right now is when the desk nurse comes in. She says in this video she's not a nurse, so maybe she's a tech, maybe she's a whatever. But this basically, Chelsea's sister has called. And Teresa, you know that I took care of that today. Because I have some other things to go with this. Okay. So CNA tech, right. Okay. So she came in after Chelsea's sister called, or the aunt called and said, hey, because I work in pediatrics, why are you treating them this way? And this is what happened. Okay.
Like that, the nurse practitioners will come over and talk to you. You can call a doctor or whatever you want to, but she is not going to talk to me like that.
We asked Yeah, I'd huff and puff away too. Yep.
She's coming right now.
Yeah, you're a real professional. You know that?
Yeah, and you are too.
Oh yeah.
So let me just say this, parents don't have to be professional. There are actual studies, and we talked about this when we were protesting the closure of the NICU. We talked about the fact that many parents who have NICU children suffer from PTSD. It is very traumatic because you're not sure if the babies are going to live. You're not sure if mom is going to live. It is not a case. So when she turns around and says to the dad, "So are you?" when he says, "You're very professional," and she says, "So are you?" it's not his job to be professional. It's his job to be a parent. It's his job to be a parent. It's retaliation on the parent's complaint, but it's also proof that they have no accountability. So if you hear what she says, the nurse practitioner will come in and she says, "But she will not talk to me like that."
She is not going to talk to me like that.
We asked the person that was over here.
Yeah, I'd huff and puff away too. Yep.
She's coming right now.
Yeah, you're a real professional. You know that?
Yeah, and you are too.
Oh yeah.
Now watch this.
I don't like to be talked to like that. I'm trying to.
Okay, well I'm sorry, Hushies.
I'm not even a nurse. I have nothing to do with any of this.
Okay, and nobody.
She said, "I'm not even a nurse. I have nothing to do with any of this." In other words, listen, none of this my responsibility. I'm not a nurse. I have nothing to do with any of this. Really? Well, why do you have a job there? Why are you working in this NICU?
Said nothing to you. Whatever she said, that's not.
You're the ain't her sister.
Okay, yeah.
So look, she said the ain't, her sister, and then she poked the mom with a pencil. She poked this mother with a pencil and said, "The ain't, her sister." And I'm going to show you what the mom's arm looked like after being poked with the pencil by the staff member.
You do not need to touch her. You'll get.
So this is mom's arm after she's poked with the pencil. So the babies are home now. I'm going to show you several other images that have recently come into my possession. And I'm not showing you all of them, nor am I showing you all the video. What I will say to you is that, like always, I have contacted the proper healthcare agencies with all of the information. I did that earlier this afternoon. Okay. But I want to show you some images that made their way to me, not from parents, but from staff. Okay. Hold on to your horses, folks. And let me preface this by saying these images have been taken over the last 2 years. Okay. One of these pictures has a date on it. I asked if it was currently still in this condition, and I was told yes. So let me just show you what was sent to me. Okay. That is medical tape holding equipment on the wall. Do y'all see that? That's medical tape. Do you see these outlets that are covered with medical tape? And it says broken, do not use, engineering aware. And it's dated August 13, 2019. This is in the Niswonger NICU. According to the individuals who sent this to me, this is in the Niswonger NICU or Johnson City Medical Center NICU, whatever. You ready? Here we go. Those are the suction deals. These are supposed to be emptied. What is being alleged is that there is not, especially at night, that there's not a lot of staff, cleaning staff. That's what's being alleged is that there's not a lot of cleaning staff, and like these are the suction canisters. I know what those look like. Kia, you said your trash can looked like that for 2 days when your son was there until you threatened to drag it into the hallway. So your experience, Kia, was that when your son was in the hospital, was it also at Niswonger? And was your experience that that there were not a lot of cleaning staff and the rooms were not cleaned regularly? Okay. And they were using his they were using his G-tube supplies right with it. So I'm going to share something else with you today that I've been given permission to share. This is by a healthcare professional in the area who experienced something while trying to take care of their home patient. So, like I said, I've been given permission to share this information. So, this particular nurse takes care of a pediatric patient with in-home health care. And this pediatric patient requires a vent. Okay. And they take this pediatric patient to Knoxville. Hold on one second. Yeah, Kia, send them to me. Chelsea, you said I had cleaned the isolate myself one night because it had gotten so bad, and a nurse had asked what I was doing, and I told her, so she rolled her eyes and walked away. Gotcha. Let me say this to you, Chelsea. I am so sorry this was your experience. Because when Bella was at Holston Valley Medical Center, we got exceptional care. We did. We got exceptional care. It was clean. Staff attended to us. They talked to us. Like they prepared us for the roller coaster that we were going to be on. They taught us about like when the alarms would go off, if they were yellow versus when they were red, so that we would not be so anxious with what we were experiencing. They explained to me about like the oxygen levels and like where we needed her to be. And we just got phenomenal care. And I am so sorry that that's not what you've gotten. I will share this with you. I was also informed that over the last 2 years or so, the NICU has lost 30 nurses in 2 years, give or take a little bit. 30, and that's not counting travelers. So listen, I want to go back and tell you this because this is important. This is really, really important. This pediatric patient has to go to Knoxville to have their vent changed because there's no pediatric pulmonologist at Ballad Health. Okay. So this pediatric patient needed to have his vent. He needed some settings changed for this vent. And in order to do that, they needed to draw some blood gases. Okay. So this particular nurse was trying to figure out where to have that done because they have to monitor his CO2 levels. and they were trying to avoid going to the Niswonger ER because of the new crisis staffing, even though, if you remember, Ballad Health claimed that any positive COVID employee would not be working in Niswonger. Do you all remember that? That was the claim. I watched Alan say it in that news in the press briefing. He said there were several different places where COVID positive staff would not work, and Niswonger's was one of them. Well, listen. So this nurse had called several different places, trying to even called like adult pulmonology, but they didn't have the equipment. This nurse even called TennCare, trying to figure out if there was anywhere else that they could go. And everyone said, no, you're going to have to go to the Niswonger ER to get these blood gases drawn, because they are the only people that have the equipment to do this, to do these labs. So listen, she talked to an employee who works in pediatric phlebotomy at Johnson City Medical Center. And if you're wondering, I'm looking at my phone while I read this. Now, she did clarify this and tell me she does not know if this employee is a nurse or a desk person or whatever, but this person works at Niswonger in pediatric phlebotomy. And they were getting the orders faxed for the paperwork for the blood gases, to draw the blood gases. And this nurse, the home health nurse, asked the pediatric phlebotomy person, staff, and she said, I probably shouldn't ask, but are your respiratory people working, and are they COVID positive? And I'm going to quote this for you. She danced around the topic for a minute, and then she told me she's positive. She was diagnosed last week, and because she doesn't have fever, she is required to work. She told me she still has congestion and a cough, and she is working in pediatric phlebotomy at Niswonger. Now, guys, this is information sent to me by a healthcare professional who works with at-home patients, and this is what she is alleging this employee said to her. Now, I followed up with her today. And by the way, she did give me the name of the employee, but I'm not going to say it on this live. Okay. But this is what she said. She said, so the exclusions for not working and being COVID positive for Niswonger are BS. So I'm going to fast forward. I reached back out today and I said, I'm checking in on how things went today. And she said it went okay. And she said the respiratory therapist did wear PPE. She said the nurse at the pulmonology had requested it on the order too. I will tell you that the person she spoke to yesterday that told her they were COVID positive was also working today, because she talked to her again today. Here's the thing. Don't say it if you're not going to do it. You all made this big deal about saying, well, there were going to be exclusions, right? We're not going to let COVID positive people work in Niswonger Children's Hospital. They're not going to work in hospitals. They're not going to work in oncology. They're not going to work wherever, right? But this is an employee saying, I'm positive. I tested positive last week, right? This is an employee telling another nurse who works in home health, right? I'm going to say this other part, and I can't report on it until I talk to this person directly. But I received some information about COVID rooms and how maybe they are and aren't being handled. And maybe I'm tipping my hand, but I don't really care. So like, let me just say this. If by me saying this, it makes somebody at Ballad go back and change it and do it right before someone comes in and inspects, I'm okay with that. Because if it's in the best interest of patients, then I'm okay with that, right? It's not about trying to hurt Ballad. It's not what it's about. It's not what it's ever been about. It's about ensuring that the people in the region have access to quality, safe health care, right? And I'm sorry, guys, but it doesn't look like this. I don't understand how you can pay lobbyists and how you can, give out $3 million in bonuses, but these images were taken over the last 2 years in your NICU after you closed down Holston Valley Medical Center's state-of-the-art facility. You'll ask me, why do I report on things like this? Because it's in the best interest of the public. I believe that the public should know for their own health and well-being the state of their hospitals and healthcare systems, especially when they are your only choice for inpatient care. You don't have another NICU unless you go to Knoxville or Vanderbilt or Roanoke, right? You all don't have another children's hospital to go to. You don't have another NICU. And that matters. It matters. So, this is what I wanted to share with you tonight. Chelsea, the mother of the twins, that I showed you earlier, this little joker right here, right? She is going to join me for a one-on-one in-depth interview. Maybe Dad will join me too, to give their firsthand experience of what it was like having their twins in the NICU, what they experienced. You've already seen some of it tonight. You've seen the pictures they took, which I'll show you one more time. You will see the pictures they took and the video they took. That is the sheet. That just blows my mind. The difference in what our Bella got. Guys, we would come in and Bella would be, spotless, head to toe. They even took, y'all have seen me when I wear my head wrap sometimes. They even took her little baby hat one time and like folded it over like my head wrapped and had it taped. You all saw all the videos I posted. Josh, I don't know. What I do know is that people tagged local news agencies in her post. I do know that. I do know that people tagged like local news agencies in her post on Facebook. To my knowledge, I have not seen any of the local news places cover the story. For me, I believe it's important to cover this because I think you have to look at the big picture. Like if you take any one of these things, they're bad by itself, right? So if I say, hey, a medical professional in the community reached out to me because they were told by a Ballad employee, I have COVID, I'm positive, and I'm working in Niswonger, right? That in and of itself is horrible, right? And that's what this medical professional is telling me, has alleged to me. So that's one piece, and that's bad, right? And if I show you where Ballad Health said, hey, we're going to save $1 million a year by closing Holston Valley Medical Center, and yet in the very first year that they closed that Holston Valley Medical Center NICU, that $1 million that they said they were going to save was simply deferred, and it became part of the $3 million in bonuses that they gave to their executives. Right? merger synergies. That's where they told the SEC their money was going to come from, right? So that in and of itself is bad, right? It just looks horrible to say, oh, we're going to close this neonatal intensive care unit that takes care of these babies. We're going to leave Southwest Virginia without, a NICU that's even on the border, right? Because that was the closest NICU that they had. We're going to take all this away because we need this $1,046,000, right? And then turn around and in that same tax year, give your executives over $3 million in bonuses. Just Alan Levine and Tony Keck alone was over $1 million. So that story in and of itself is bad, right? And then if I take the raise money and I say, listen, this $1,250 that you wanted to make it seem like was such a big thing you gave your employees, when you break it down for a full-time employee who works 40 hours a week, for an average of 2,080 hours a year, it's really only 60 cents an hour raise, which is barely keeping up with inflation if you make $10 an hour. And if you make more than $10 an hour, it doesn't even keep up with inflation while you've been busting your ass during a global pandemic. Like that in and of itself is bad. And then if I say to you, you claim to have this wonderful perinatal, amazing children's hospital, right? With this NICU that was supposed to be, the savior for all the babies in the region because damn it, we didn't need Holston Valley. And then I show you pictures of a baby with stuff like this. Or a nurse screaming at parents and poking them with a pencil because they don't like the way the aunt talked to them on the phone. When I see things like this, and then I hear Alan Levine say in a press conference, we will not put our patients at risk. Well, what the flip do you call this? When I have staff saying to me, listen, because you guys, you realize these right here, these are what you call immediate patient safety issues. That's the terminology. These are immediate patient safety issues. When I am told that part of the room, the flood that took place in 3400, when I'm told by multiple people that room has flooded before, when I'm told that room has been closed off before, when I'm told that sometimes if you plug stuff into the wall, it might spark, or I'm told that if you pull that out of the socket, you have to hold it so that the socket doesn't come out with the cord. Those are immediate patient and staff safety issues that need to be addressed. Why aren't they? And yet the Tennessee Department of Health acts as if this public advantage is good for the region. I don't know. So, awesome, Martina. Appreciate it. And you can send her my way if she needs some additional backstory or, to touch base with the individuals. Y'all know me. I don't ever say who sent me information. In this case, the mom put the post publicly on Facebook and she said, yes, that I could share it. I asked permission. It breaks my heart. Because these are families and babies and moms and dads, and they're already going through enough. And to be quite frank, staff is already going through enough. From what I understand, from what I understand, a lot of the folks feel like, and let me not say that. Here's what I can say. The staff that I spoke with said that the general feeling is that management just isn't going to do anything about the issues. That's what they said. Because I asked if variant reports had been filled out and filed, and they weren't really sure. And she said, "Well, I haven't," and and then the statement that was made was that well, the general feeling is that they're not going to do anything about it anyway, and people are still terrified to file reports. People are still terrified. I asked, "Are you concerned for your license?" And emphatically, I was told, yes, absolutely. I have been told by multiple sources that at least one travel nurse left during her assignment from the NICU because she refused to work in conditions where she felt like her license would be at risk. And I was told that by multiple sources. So anyway, that's all I have for you tonight, folks. Chelsea says, I tried to speak to everyone about the things that went on and they excused and looked over everything. Yeah. So Chelsea, you let me know when, and the way that it works is it's going to be a broadcast just like this. All I have to do is send you a link. It'll bring you on. You can get on your phone or on your computer, and we'll talk a little bit beforehand just so you can be comfortable. And we're just going to have a conversation. I have been where your family just came from. My daughter has been where you guys just came from. Bella was 1 pound, 3 ounces. We get it. Okay, Kia, great. And, it's important that people know what's transpiring, yeah. So, Teresa Archer says, I know you're talking about Niswonger, but I had open heart surgery on November 16th at the Heart Hospital at JCMC. You developed blood clots, so you had to go back. And you had a problem with cleaning then as well. Yeah. So they've contacted the news several times and it was overlooked. Well, so let me just say this to you guys. I don't report on everything that gets sent to me, right? But in this particular case, in the last week, I had received 3 or 4 things all related to the NICU and Niswonger and Ballad. And I felt like it was important to take a look 2.5 years later at what we were promised, the comprehensive pediatric regional trauma center that we were promised, that they're not even required to do anymore, hasn't happened. The fact that, they're the medical monopoly in the region and they still have trouble recruiting pediatric specialties and subspecialties, when people are still having to go to Knoxville for pediatric pulmonology, right? Why is that? Because think about it. If I'm a pediatric pulmonologist and I'm being recruited by Ballad, and I know that I would be the only pediatric pulmonologist in the region for an area that has 1 million people, you would think that would be an enticing thing for me as a physician, wouldn't you? I mean, to have that sort of market dominance, you would think would be appealing. So again, it begs the question, what's the trouble with hiring and retention? I don't know. All right, folks, that is all I've got for you. Thank you all for tuning in and sharing. I'm going to be getting with Chelsea, the mom, and we'll be doing another broadcast. We may do a special one, or we may do it on Tuesday, depending upon what her schedule is like. Yeah, Linda, I can't not care. It's just that simple. I can't not care. Every parent and grandparent should get the care that we got with Bella. Girl, they ain't changing that name. You know, Nicemonger gave all that money. Scott wants his name on that building. All right, you guys, I'm getting out of here. Be amazing, be like, be love. I will see you Tuesday at 8 p.m. Eastern Standard Time, if not before then. Please make sure that you are following me on the Rantings of Danny page so that you can see these broadcasts when they happen. Also subscribe to the YouTube channel, that sort of thing. If you have information that you want to get to me, you can send it to, somebody type this in the comments for me. You can send it to thedannycook@protonmail.com. That is my encrypted email address. And you can even set up your own Proton Mail email so that it is secure and encrypted from end to end if you have concerns. But yeah, so if you have something that you want to get to me for whatever reason, let me know. Remember that you can file complaints with the Tennessee Department of Health, the licensure for healthcare facilities. You can do that anonymously or give your name. They will investigate. They will give you a case number and they will give you a letter for the outcome. Okay. You can also file complaints with the Centers for Medicaid and Medicare. Okay. Because 70% of Ballad Health patients get their insurance through CMS. So you can also do that as well. And then your own private insurance companies if you have that as well. Okay. So that's it. I will talk to you guys on Tuesday. Be amazing. Be light. Be love. Peace.